Ladies and gentlemen, America won't do anything about this drug epidemic other than say it's public health and these folks shouldn't go to jail. But in the meantime, the roads are getting more and more dangerous for the average person because many of them are drugged out behind the wheel. So America is more concerned in shielding and protecting people that are now killing and harming folks on the roads. But they want to still get on the soapbox and tell us these folks don't belong in jail. This is a public health. They need help. They need this. They need that. But in the meantime, they're behind the wheels, running over people, hitting people on the road, causing all kinds of accidents, and they don't care. Just keep them out of jail. Patients who are prescribed opioids and the clinicians who prescribe them have more to be concerned about than steadily rising rates of opioid overdoses, according to a new study. Research public Friday and this is the medical journal JAMA Network Open, shows that drivers are on prescribed opioids are twice as likely to be in deadly two-vehicle accidents than those not using the drugs. As the U.S. struggles with the opioid plague, these findings could affect healthcare providers' decision-making processes, the author says. Now, the term they use for this is drugged driving. Drug driving, ladies and gentlemen. So, statistics from the U.S. Center for Disease Control and Prevention show that although the rate of opioids prescribed per 100 people decreased from 72.4% to 66.5% from 2006 to 2016, 214 million opioid prescriptions are written each year. So no matter how much they're telling all of us, ladies and gentlemen, that there is a decline in prescriptions, people are still high out here. Believe me, if they can't get a hold of the legal drug, they'll get it illegally and still get behind the wheel. It doesn't matter. But the bottom line is they're putting everybody out in danger. And I have seen these people on the road. In fact, it was this past summer, I was out and it was somebody riding in one of those pickup trucks sporadically on the road. And as soon as the light turned green, he went right into a pole. So these folks are out here and they're very dangerous. Study author Dr. Guhua Lee, a professor of epidemiology and anesthesiology, and the finding director of the Center for Injury Epidemiology and Prevention at Columbia University. All right, so much for those long ass titles. We're motivated to take on this research because of the ongoing opioid epidemic that has spilled over to the nation's roadways with deadly consequences. Exactly. Okay, so if you're saying you don't want to jail your junkies because they need help, then you need to get them that help. If you are not getting them that help and they're all over the roadways killing people, then you, who are declaring this a public health emergency and giving these addicts amnesty, you are 100% responsible for all of these people dying on the roadways because of your policies. Your policies are killing people now. For the study, the researchers used data from the National Highway Traffic Safety Administration Fatality Analysis Reporting System, which contains records from throughout the United States on motor vehicle crashes with at least one death within 30 days of the accident. The data is based on driver related factors, the unsafe actions of drivers that lead to crashes, a driver with at least one driving error resulting in the fatality crash becomes known as a crash initiator. The researchers used these driving errors to measure which drivers were at fault for crashes and used toxicology results to look for the presence of opioids. After looking at 18,321 driver pairs who died in two vehicle accidents between 1993 and 2016, Lee and Kahuri found that 57.7% of deceased drivers who tested positive for prescription opioids crash because they were unable to stay in their lane. Now, how many times have we been driving down the highway and see people swerving in and out of their lane? It's so common. You see it all the time. But when you're looking at it, do you think about that person might be under the influence of opioids? I didn't before in the past, but I sure do now. And when I see that, I try to back away. I don't want to go near that person. Just use caution when you're out there because these people are everywhere and they just don't want to come out and tell you. There's a high number of people on the roads today under the influence of drugs. And it's probably just as much of an epidemic as the opioid epidemic itself. These folks behind the wheel, that's another epidemic. Additionally, more crash initiators overall tested positive for prescription opioids, alcohol, or both than those who were not inhibitors. Previous research has shown that opioids can impair drivers by causing them to be drowsy, dizzy, or even sedated. By decreasing alertness and increasing reaction time, opioids cause patients to be at increased risk of crashing while driving. The medications often carry warnings against driving, operating heavy machinery, or participating in other potential dangerous activities while taking them. The author acknowledged limitations to the study. Drivers who tested positive for opioids were not necessarily impaired. Also, the fatality analysis reporting system does not record the dosage of opioids or alcohol. And although driving errors were standardized to understanding who was at fault for the accident, this may not be enough information and varies from state to state. Ladies and gentlemen, I don't care what they say. Whenever you see these people on the road, be careful. Be careful. Lee and Shahiri conducted a previous study that showed that before the onset of the opioid plague in the 1990s, opioid use was responsible for only about 1% of driver deaths in the US. As both illicit and prescription opioid use has increased, the number of motor vehicle deaths from opioid use has increased to at least 7%, the study says. To reverse this trend and ensure that patients do not fall victim to driving under the influence, education and collaboration between patients and clinicians is necessary, the researchers say. But you know what, ladies and gentlemen, I don't care what studies these folks do. The bottom line is we all know they don't want to jail these people, which puts all of us at risk when we're on the road. Number two, why does a fatality have to happen before it gets your attention? How do you keep up a drug habit if you're not on the road trying to get to your dealer? if you are not constantly on the road trying to get the drug from someone. And you also got to filter in the fact that many of these junkies have jobs they have to drive to every day. So they're literally getting in their cars, driving to work every day under the influence. They're already high, leaving out of their house. So please tell me what you think, ladies and gentlemen. I mean, this is a disgrace. And it's a disgrace the way America handles this drug epidemic over the last 2 decades. Just go back and look at how they've handled this whole thing, and you won't be shocked by the reason why it's so out of control today. So, the way I see it, people getting killed on the roads because of these drug addicts is the drug addicts' fault. It is your politicians' fault for putting policies in place that won't do anything about these addicts. It is the people screaming public health, they need help. But in the meantime, there's millions of them on the road every day as you're sitting there screaming they need help. It's all of your fault. You're the ones that are in charge and in control of this country. And this opioid plague is just an example of how poorly ran everything really truly is. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. And keep yourself and your children safe out here with all these junkies behind the wheel, and America will continue to pat them on the back and say it's a public health issue. Peace, family.